Presentation describes intravenous catheterization in the horse. IV catheters are either used short-term or long-term. The short-term usages would include induction and maintenance of anesthesia, administering emergency fluids, and performing euthanasia. The long-term usages include IV fluid therapy and long-term IV medication administration. Selecting the appropriate catheter is very important. You want to select the catheter that is the shortest length, smallest diameter, and least reactive that will get the job done. These three aspects will minimize the likelihood of thrombophlebitis occurring. For catheter length, really short catheters are commonly used in foals and small ponies, and are only for short-term use. Catheter diameter corresponds to the need for speed, meaning how rapidly the medication or fluids need to be delivered. A 10-gauge catheter is used for emergency administration of large volumes of fluids. 16-gauge catheters are used when the horse needs repeated IV medications administered, and 14-gauge catheters are used to deliver large volumes of maintenance fluids, and this gauge is the most commonly used. The catheter material is also very important because it corresponds to any reactions the horse may have to the catheter. Polypropylene is very stiff and the most reactive, so you don't want to use it more than 24 hours. Teflon and polyurethane have moderate stiffness and reactivity, and you can use those for up to 7 days. Silicone is the least stiff and reactive, so you can use this material up to 4 weeks. You may think, well, why not just use silicone all the time? But the different materials only come in certain diameters, so you have to decide which is best for the use you need. Polypropylene has a large diameter, so it's used for emergency IV fluids, whereas silicone only comes in a small diameter, so it's used for neonates. That leaves Teflon and polyurethane, which are the most commonly used. The most common site to place an IV catheter in a horse is the jugular vein. When you hold off in the jugular groove, you can see the vein distend. You want to place the catheter as far upstream as possible, so if you miss and a second attempt is needed, you can just move downstream. This helps to minimize irritation to the endothelium that is now trying to heal. The materials you will need to place an IV catheter include clippers with a number 40 blade, surgical scrub, and alcohol. You may use a local anesthetic like lidocaine. You'll need your catheter, the catheter cap or injection port, flush, which is typically heparinized saline, 2/0 non-absorbable suture, and a 20-gauge needle. The placement procedure uses an aseptic technique. First, you're going to clip a small patch of hair over the vein, perform your surgical scrub 3 times. Then if you're going to use a local anesthetic, you would apply that then. It's just a subcutaneous bleb, no more than 1 ml is used. And then you insert your catheter at a 45-degree angle. Once blood is seen in the hub, you can advance the catheter, pull out the stylet, and apply the catheter cap. Then you're going to flush the catheter and secure it by suturing the hub to the skin. You may apply an antibacterial ointment around the insertion site, and long-term catheters should be secured further with gauze and vet wrap around the horse's neck. Here is a short video of the catheter placement procedure. So I'm going to show you how to put an IV catheter in a horse today. So the most common place to put an IV catheter in is the jugular vein, which is located right here in the jugular groove. This you have to do an aseptic technique. So the first thing you want to do is clip a little spot. So you want to do about right there over the jugular vein. And then you're going to want to scrub. So you do 3 scrubs, like a surgical scrub. So you do your scrub, and then your alcohol, and then just do that 3 times to get it nice and clean. And then you can get your catheter ready. So you want to make sure that it comes off nice and easy, there's no burrs, and it's ready to go. And then I also have my cap right here, so I can pull that off and cap the end of the catheter once it's in. Okay. There is the option to do a lidocaine bleb as well. so you can do it right where you're going to poke and just like right under the skin, sub-Q injection of lidocaine if you want to as well. There's pros and cons, but that is an option. Okay, so you're going to take your catheter, you can hold off. You want to hold off relatively closely to where you're poking so you get a nice distension of that vein. So if I let go, you can see it go down. So you see it blub up. So then you would go ahead and poke. Once you get blood in the hub of your catheter, you can advance the catheter and then pull out the stylet once the catheter is all the way in. And then you can go ahead. Okay? And then what you can do is flush the catheter. Make sure that it's in correctly in the right spot. Everything's going through nice and easily. And then you're going to want to suture it in so it stays in to the horse. So what you do is you take about 20 gauge needle and then you grab a little bit of skin under that hub of the catheter. You poke in and then you would put your suture in through the other end of the needle. You would put it in through that end of the needle, and then when you pull your needle out, it'll be over the catheter like that, and then you can just tie it in and do that in a couple places, and then it'll be secured to the horse. Maintaining the catheter is very important in terms of making sure it continues to function properly and also to ensure it is not introducing any infection or causing any other issues. You need to keep the catheter area clean, so a good way to do this is by replacing the injection cap every 24 to 48 hours. You also want to minimize motion of the horse as much as possible, so confining them to a stall is a good way to do that. You want to flush the catheter regularly, which would be a minimum of 4 times a day. We flush the catheter to prevent clotting, and you also want to flush it before and after any medication administration. Then just in general, you need to observe the catheter for any problems. This would include any leakage, also any thickening, swelling, pain, or purulent exudate. Also, you should palpate the end of the catheter to ensure there isn't a thrombus that has formed. The removal procedure for the catheter is pretty simple. You will carefully cut and take out the sutures, then gently pull out the catheter and apply direct pressure to the site for about a minute. During this time, you can elevate the head, which can decrease the incidence of hematoma formation. Next, you will clean the site and apply some antibacterial ointment. Here are the references I used for this presentation. Thank you for watching, and I hope this helped you to better understand the procedure of an IV catheter.